Hi everyone, our group will be presenting on X-rays, one of the most important discoveries in modern physics. These are our group members and I would like to start my part first. X-rays are type of electromagnetic radiation that have very short wavelength and high energy. Because of these properties, X-ray can pass through many materials, including human body tissue. X-rays were discovered in 1895 by a German physicist named Wilhelm Conrad Röntgen. During his experiment, he observed unknown rays that could penetrate objects and create images on a photographic plate. This discovery revolutionized the field of medicine and earned him the first Nobel Prize in Physics. X-rays play an important role in medicine. They help doctors diagnose injuries and disease quickly without the need for surgery. X-rays are commonly used in hospitals and clinics for medical imaging. Now, let's look at the properties of X-ray. First, X-rays have high energy. This allows them to penetrate different materials and produce images of internal structures. Second, X-rays have very short wavelength, which are much shorter than those of visible light. This enables them to reveal details that cannot be seen with ordinary light. Finally, X-ray can penetrate body tissue. Soft tissue such as skin materials like bone absorb more X-ray. As a result, bones appear white on a X-ray image, while softer tissue appear darker. These unique properties make X-ray very useful in medical diagnosis and imaging.
Production of X-ray. X-rays are produced inside a vacuum tube called as X-ray tube. The tube contains two main components, which are the cathode and the anode. When the cathode filament is heated, electrons released through a process called thermionic emissions. A high voltage is then applied across the tube, accelerating the electrons toward the anode at very high speed. The anode is usually made of tungsten because it has a high melting point and can withstand the heat generated during the process. These high-speed electrons carry a large amount of kinetic energy, which is essential for the production of X-rays. How X-ray is generated? After being accelerated, the electrons collide with the tungsten target of the anode. During this collision, the electrons suddenly accelerated and lose their kinetic energy. Most of the energy, almost 99% of them, is converted into heat, while only 1% of them is converted into X-ray radiation. Although the efficiency is low, the amount of X-ray produced is sufficient for medical imaging. The generated X-ray then exit the tube through a special window and are directed towards the patient body to create a diagnostic image. Medical uses of X-rays. X-rays plays an important role in modern medicine. One of the most common applications is detecting bone fractures and joint injuries. In dentistry, X-rays are used to identify cavities, tooth decay, and abnormalities in jaws. Chest X-ray help doctors to identify and diagnose such as lung disease, such as pneumonia. Another important application is like tomography and CT scans, which use multiple X-rays that taken from different angles to produce detailed cross-sectional part of the body. Due to their speed and accuracy, X-ray remains as the most widely used diagnostic tool in healthcare.
Assalamualaikum and hi, my name is Nabila and I'm going to talk about the advantage and result of X-ray in medical use. So first, the advantage. X-ray give fast results usually within a few minutes. This helps doctor quickly find problems like broken bones, lung infection or injuries, especially in emergency case. Next, it's non-invasive, which is mean no surgery, no needles, and it's not painful, so it's quite comfortable for patient. It's also cheap and widely available, so most hospital and clinics can provide X-ray service easily, even in smallest place. And lastly, it's really good for checking bones and teeth because it gives clear image of hard parts in the body. Doctor can use it to find fracture and also see how healing is going. For the risks, X-ray use radiation, so if the person is exposed too much or too often, it can slightly increase health risk like cancer, so it can be controlled. It can also cause small damage to cell and tissue, which means why safety steps like leak protection are used. For pregnant women, doctors are extra carefully because radiation may affect the baby development, especially in early pregnancy. Some X-ray tests use a special dye called contrast media, and a small number of people may get allergic reaction like itchy and rashes. Lastly, X-ray is not very good for soft tissue like muscle for the brain, so sometimes doctor need other scan like MRI. Next, move to the X-ray safety measure. First, doctor follow something called the ALARA principle, which means radiation is kept as low as possible, so only the minimum amount of radiation is used, just enough to get a clear image. Next, patients are given protective shielding like lead aprons or thyroid shield. This helps protect sensitivity body parts from extra radiation during the scan. Then, if patient is pregnant or might be pregnant, they must inform to the healthcare staff before the X-ray. It is important because doctor may choose safer alternative like ultrasound or MRI. Lastly, for healthcare workers, there are a device called a dosimeter. It tracks how much radiation they are exposed to over time, so it always stay within safe limits. So the conclusion is X-ray are fast and non-invasive medical tool that helps diagnose internal condition effectively. Although they involve low-level radiation risk, they are safe when used properly and are essential in modern healthcare. That's all for me.